Side Fatiha, please. Thank you all for coming. And today we are blessed to have Dr. Nasir Ali with us. And he has been a member of our community for a long, long time. Uh, an active member, even though he is not always in the limelight, but he is always a example of a supporter, uh, contributor, active member. He is now active on the board, on the foundation board. So we're extend our gratitude for Dr. Nasir Ali for his service and support. But today he is going to speak about medical subject, and it concerns, I'm sure, all of us, which is respiratory disease and how to avoid it. Dr. Nasir, thank you. If you want to
I think this is
give
long
it
enough.
for this.
No, I'll just stand right here.
Very good.
I'll stand right here.
Thank you.
Well, good afternoon. This is a very, very great privilege for me. I can sort of tell you, Saleh, the reason I was not in the limelight here, because I was educating not only my students, my residents, and fellow doctors, but my own family members, and I've tried to help all my life somebody who needs help. That's the reason that I was not in the limelight. All right. The subject for today, before Dr. Hussein left, he asked me what I want to choose. I said, there's so much talk about respiratory tract infections these days, in the news, social media, wherever you want to talk about. And respiratory infections, which are now called as tripledemic, is because of respiratory syncytial virus, influenza, and COVID is still hanging around. Those are viral infections. Now, let me just introduce you to the subject, how we prevent ourselves, how we fight ourselves to fight the infection off. Infection is everywhere. And there are a lot of different reasons that you can have respiratory tract symptoms which sound like infection. And I'll also give you that introduction. Basically, humans are exposed to, anytime you breathe through the nose and the mouth, to anything around in your environment. An environment is bad air, quality of air, carbon monoxide, carbon dioxide, methane. If you work someplace in a bad, dusty environment where you are a firefighter and you're exposed to smoke and fire, all the gases produced, as well as day-to-day work, ever since you're born till you're going to die, you're exposed to bugs which are in the air, which are all around us. And there are several different categories. I'm going to limit myself to basically viruses and bacteria today. I can sort of tell you the respiratory tract infections comprises of so many different kinds of categories. And let me ask some of the medical doctors in the audience, do you know the most common respiratory tract infection which has affected mankind all over the world?
Common cold.
The respiratory infection which
Rhinovirus.
causes significant morbidity.
Oh, morbidity.
Pulmonary tuberculosis. We are 8 billion people in the world, and 2.5 billion are infected with tuberculosis. It's more prevalent in certain areas, but it's a slow-growing organism, so we can slowly acclimatize and immune system can control it. So many people are walking around with positive tests for tuberculosis, but have never had any disease because our immune system is great. So let's talk about how we defend ourselves. One of the most important thing is your own mechanical things right within your air passages, starting from the nose to the voice box to the windpipe and all the bronchial tubes. And one of the most important things in the nose is your hair in the nose. Do you know they trap a lot of the large bugs as well as large particles greater than 10 microns? They can be just trapped right there, never go down. And the second important thing is the respiratory tract. There's something called as lining cells, which are called as cilia, and they also are associated with some mucus-producing cells. And they basically are not all that bad. They trap things, and they try to eliminate from your own respiratory system out to the air, or cough it out, or do a sneeze, or do whatever you need to do. But the most important common manifestation of something irritating your respiratory tract is the production of cough. Cough is actually a defense mechanism. It tells you that there's something wrong. It cannot tell you what that is, but it tells you there's something wrong. Now, mild cough which goes away is not a major concern. But the cough which persists, and I tell everybody, all my family members, anytime you have a cough longer than 3 weeks, go see a doctor. Don't hold on to it. Don't think it's reflux or my sinuses. Just see somebody because it could have some serious implications. So cough is a very important mechanism. But the two other areas which are we are blessed with is number one is in the blood system, number two is in the cell system, which are certain types of cells which give you immune system which defends yourself against the infections. And the humoral system of the antibodies which are circulating ever since about by about 6 months of age, you have plenty of antibodies. If you are breastfed, you have it right at birth. But if you're not breastfed, it may take about a couple of years. It may take a little longer. So we are all blessed with own defense mechanisms. So what is it which makes us suffer from symptoms? Number one, it's all a fight between your human body as well as all the bugs which are coming in. If there are a billion bugs coming in and your body is overwhelmed, you begin to develop symptoms of an infection. So you may have infection but may not have any symptoms. So it's very important. What an infection does is it produces inflammation, which sort of brings in all the white blood cells and all the other cells, which sort of try to get you not let it go down deeper into your respiratory tract, which is the lungs. When it does affect the lungs, it becomes a very serious situation and actually becomes what is normally called as a pneumonia. It's a common term. When people cough a lot, have fever, obviously that's the first thing to come to mind. And that's why I feel that you need to get to see a doctor so that you get treated promptly. Because the best way to approach an infection is earlier the treatment, the quicker is your recovery. If you delay treatment, recovery may be there, but it may take longer. Some infections overwhelm you very quickly, within anywhere from 4 to 24 hours. Others may take 3 to 7 days. So it is important for us to recognize that all this situation. Now, viruses, I introduced the fact that there are a lot of viruses, but the most common, I won't even go into the classes. There are adenoviruses, there are rhinoviruses, there are influenza, which is an adenovirus. And right now, that is a big problem. Hospitals are busy with all three of them, especially the younger generation. So it doesn't really matter what, but what it is when the infection becomes serious, it can be life threatening. The commonest infection humans suffer is from the urinary tract, but respiratory tract is the most serious one and can be devastating and potentially fatal. Now, what are the common ways the infections represent themselves? The most often is the constitutional symptoms, which are accompanied by not feeling good. Number two, can't eat. Number three, may have fever or feel hot and cold. And anytime you feel that sensation, check your temperature. Must have a thermometer at home. And don't guess it. Just try to check it. because the actual checking is very, very, very important. And obviously, when it becomes more severe, the symptoms of respiratory tract where it affects most become more dominant. In the nasal passages, it's the runny nose, nasal congestion, stuffiness, or blowing some thick, discolored mucus. Once it goes down to the windpipe, it produces hoarseness. Once it goes down to the trachea, it produces cough and shortness of breath. And once it goes down to the lung, it may have chest pain, it may have cough, you may spit up blood, all kinds of different things. But that is actually an advanced stage. The common patients with pneumonia don't really present with that sort of situation because they can be diagnosed right in the office and treated as an outpatient. And a physician may decide whether a chest X-ray is needed or not because it entirely depends upon what the person is feeling like or what will make them feel better. If they want a chest X-ray, take one. Nothing wrong with it. So all of this means that these infections, viruses are all around. But the most serious and devastating infections are the bacterial infections. Bacteria are larger sized microbes or organisms, larger sized than the viruses are, and generally tend to create a much more serious situation. Some produce a sudden devastating infection in the lung, like influenza can and COVID can. Remember, COVID most of the time produced upper respiratory symptoms. It actually was such a multi-system disease. It produced sometimes the presenting symptom was belly pain or diarrhea, as if you have a gastroenteritis, or it can present as a stroke. And it is now more and more clear that viral infections can produce an immune response within your own body, which can affect multiple organs. I have to give you a little tidbit. In 1969, I was a fellow at Tulane University Charity Hospital and VA Hospital, New Orleans. And one of the directors of the program was Dr. George Birch. He was a professor of cardiology and president of the American College of Cardiologists. And our weekly programs used to be that we would go to the autopsy room, and he will have heart and lungs all there, and will ask you to tell us, based on your history, what the problem might be in the heart and lungs. I'm not show you that. And then there's the sector. That really was education, no question about it in my mind. In 1969, he published a paper in the American Heart Journal which said that the common cause of cardiac disease is a viral infection. Because he saw Coxsackie virus particles in electron microscope way back then in the heart muscle. And now we know quite a bit about the fact that it can produce damage to the lining of the coronary arteries and can produce a heart attack, can produce a damage to the lining of the arteries in the lungs, can produce a blood clot in the lung, which can be devastating. So you can imagine that viruses and bacteria all have some immune responses which not only can help us, but can also make us worse. So we cannot really take all these things very seriously. So let's talk a little bit about the commonest type of bacteria which affect sort of human beings walking around, not having any compromised situation, health situation, which makes them more susceptible to more serious bacteria. And basically they are streptococci and staph. You might have heard MRSA in the papers, etc., etc. They are resistant bugs. So those infections need to be tackled very, very quickly. And there are very great types of treatments today available for all kinds of bacterial infections. And the most important people who need to seek medical attention are the people who have underlying medical problems, chronic medical problems. Diabetes puts you at risk, smokers and smokers' lungs puts you at risk, and also autoimmune diseases, cancers. It doesn't really matter what, and chemotherapy, the treatment you receive, all messes up your immune system. So you are much more susceptible to all kinds of different bacterial infections. As a matter of fact, when I used to educate people, I would say that anybody who has an underlying medical problem and comes in, don't think about just one bug alone as the cause of the problem. think about multiple different causes that bacteria can proliferate right within the lung. Even though the major one which you think about, and the cultures which the hospital does or the laboratories do, help us identify which is the predominant organism and needs attention. So basically, this is basically an introduction, and I want to spend lots of time answering questions. The prevention is a common sense situation. You heard all about through COVID pandemic. We had social distancing, masking, and washing hands frequently. And Muslims wash hands much more frequently than in general other Americans do, unfortunately. Because I've gone to the airports, I've traveled enough to find out that how people wash their hands. It's amazing. They do like this and they're gone. I don't know what happened. The duration of time you need to wash your hands is at least 15 seconds. Longer would be better. Now, some viruses can be projectile as you cough or sneeze or whatever. Average distance is about 6 feet, but there are some who can affect you even at 12 feet. More serious or sicker the patient, more likely it is that you can have acquired respiratory tract infection just by being that much of a distance. So the best approach I used to recommend my patients, wear a mask yourself. Eastern culture teaches them. You go to China, Korea, or Japan. I've been to Japan a couple times because my daughter was there. And let me tell you, everybody has a mask on. They don't trust anybody else. They trust them. Protect yourself, and also you're helping others at the same time. So basically, the common things are obviously when the person is hospitalized, there are all kinds of different infection control measures and the things you have to go through when you're trying to prevent infections. Now, I'm not going to talk about specific antibiotics, but if anybody has any question about any specific infections they might have experienced, I'll be happy to answer those questions. But I want to leave the remaining time all for questions.
Nasir, what is the current status of the COVID now? Because we had all these variants come by, and we got the boosters, and some people said the boosters were not as helpful. Most people didn't even take them. So now I hear that they will have a booster available, just like the flu, every year, which they will include the.
I can address that issue. Anytime there's a virus, which is very serious pandemic situation, it has also, because of the fact that we rapidly brought in vaccines, the viruses are very smart. They can change their own size and shape and overcome whatever you try to bring in. Same are the bugs. We bring in some beautiful antibiotics way back in the 60s and 70s and 80s. They become smart and more, and if we misuse it, they tend to become resistant. And we bring in more, and then they become that resistant. So the best answer I can give you is that you're going to have more and more variants over the years. But the nice part is that the last couple boosters which came up are going to may not necessarily prevent the infection completely, but they may allow you to control it well enough that you don't have to rush to the hospital. And that's really the biggest thing that people worry about. Because when you go to the hospital, there are all kinds of interventions, and you may be exposed to some other bacteria as you're going down the hallway for different testing and so on. Who knows? And so that what I'm saying is that I think in the future, as I see it, is what I'm going to practice once a year, you get a booster, just like flu shot. Flu does not prevent you. There are still approximately, almost about 10 to 20,000 people die of flu every year, and sometimes even more, especially in 2009 and 10. Remember when MRSA became a very common problem, complicating flu, superimposed bacterial pneumonia, and people on the ventilator. I took care of lots of those ventilators. And as a matter of fact, I still remember a young girl who was a school teacher, and she was 6 months pregnant. And she got very, very sick, and I had to put her on a rotator bed and, complete ventilation support. And her mother would ask me every day, "Is my daughter going to be better?" I said, "I tell you, I pray for her every day myself." So I hope that she's going to get better, but it's going to take longer because she's got a very, very serious illness. And you probably also recall in the papers, two pregnant women at Toledo Hospital died in spite of artificial membrane oxygenation because it was so severe. And somehow or the other, at that time, pregnant women were affected much more so. A lot of women in the audience, I don't want to scare anybody, especially the younger ones. Pregnancy is an impairment of your immune system fighting a virus infection. You get a lot of force. That's just the way it is. And also blood clots to your legs and lungs.
The way of screening, Dr. Nasir, I remember in the good old days when we started practicing, we used to do tuberculosis tests.
Yeah.
10, 15 years later, in practice, we said cancer. So as a massive or mass screening, say for all of us or whoever is suspicious, what's your recommendation?
Well, let me try to tell you, the reason in this country it's not a routine recommendation any longer because the incidence of tuberculosis is very, very low. But I suggest to you that if you are taking a history of a respiratory infection or that got acquired, a travel history and is very, very important. If somebody has been outside the country for longer than 3 to 4 weeks, especially in a country where tuberculosis is very, very endemic, and where it is, African countries, Central and South America, Pakistan and India, even though they have controlled it nicely, but it's still there. I can also tell you that my personal story, I had an aunt who died of tuberculosis. One of my brother had a tuberculosis, was treated, and he got taken care of. I grew up in that family, but I was negative. So they gave me what is called, used to be called as the BCG vaccination. There's a misconception that BCG vaccination is vaccination for life. Wrong. It only gives you immunity for about anywhere from about 4 to 10 years. So if you had a negative test and you got BCG, and then you acquired or got exposure, whether outside or I was exposed to tuberculosis in the intensive care unit at the old Mercy all the time. And I converted my PPD in 1979. That means a secondary new infection. But my chest X-ray was okay, and I went to Dr. Carafa, and I talked to her. I said, I didn't see her. I talked to her in the hallway. I said, Camille, tell me, should I be treated? He said, you're in an age, the risk of preventive treatment could be a little riskier for you. So just follow. If any symptoms develop, which persist for a longer period of time, get a chest X-ray. And it may be best to avoid it, but it is up to you. You can have preventive treatment, which nowadays is 9 months of, isoniazid. But on the other hand, there are risks for you, and especially non-Caucasians are at greater risk for drug interaction causing some liver damage compared to the Caucasians. So I opted not to, and I'm still okay.
What about the interaction between a human and animals? Animals can get TB?
Absolutely.
They can?
Yeah. Cows used to be, long time ago, considered a carrier of tuberculosis. So if the milk was not pasteurized, you could develop bovine tuberculosis in your gastrointestinal tract. And it used to mimic cancer of the ileum and cecum. Long time ago.
But Dr. Ali, isn't it true that you say that there's a low incidence, but there's a resurgence of tuberculosis in the United States?
In certain areas, but not all over. So as a matter of fact, the common practice in intensive care unit or the hospital would be that if you have a patient who has some vague, ill-defined infiltrates and your regular antibiotics are not helping, you probably should have what is called as a bronchoalveolar lavage now, because that can give you a lot of good clues. But the best test still is expectorated early morning sputum sent to the lab for testing.
But for screening like in my addicted population, we do quantiferon gold.
Mhm.
which is a blood test
Mhm.
for screening.
Sure. Oh, there's no question. In certain clinical situations, tuberculosis still happens to be a problem.
Right.
If you ever read New England Medicine, once or twice a year, tuberculosis, tuberculous meningitis, and other things. But most of the time, those people have some problems
Yeah.
underlying.
Yeah. Comorbid condition
Comorbid.
or underlying.
And then severe COPD, chronic liver disease from alcohol, etc., or cancer, lymphoma, whatever, and chemotherapy. So those are individual situations that the doctors in the hospital have to sort of work on. So, any other questions?
Segueing it into Bahu's question about how do you see COVID? Like, is it going to be like influenza? Like every year you just get a flu shot, and the course of the disease will also will mimic that, right?
Yep. Yeah, I don't know whether you people know, common cold was COVID-1. We never put that label on them, but that was COVID-1. People walk around with a common cold, and it got better when they're on the. This COVID-2 was damn thing, came up and caused all kinds of rapidly progressive problems. Especially the most unusual part presentation was cardiac and neurologic and pulmonary. Instead of pneumonia, just a blood clots.
So, what is your recommendation now in terms of crowded indoors, travel? Of course, I get it, you would wear a mask. Like in general activities of daily living, like we say ADLs, what do you suggest in terms of masking?
Well, I think from my standpoint, right now, if you happen to go to a medical facility, I would put a mask on.
Yeah, it's their requirement too.
Yeah. Well, even if it was not a requirement, I would put it on anyway.
But what about grocery store and coming to the masjid, that kind of stuff?
I personally believe it's not necessary, because in the general population the incidence is very, very small. Okay, in specific situations there might be, but on the other hand, I think which county was it in Ohio that there was a large concentration of COVID compared to the others. So I wouldn't recommend that you do, but on principle, I mean, I can tell you, and my wife, and maybe every time she goes to a place she doesn't know about, she puts a mask on. And believe it or not, she was fully vaccinated. She still got COVID. So and she said, I gave it to her. I said, I don't have any problem. Maybe I did, but I don't have any problem. So
Because
she got that 5 days of treatment and she was fine.
The severity of the disease varies from person to person. Some people are asymptomatic, and then some people are in the ICU.
But there's no question there are certain risk factors like smoking, people with allergies, people in work situations with a lot of exposure to other chemicals and dust and fumes. They are at greater risk for respiratory tract infections and obviously underlying problems.
They've done a study about HIV, about an intrinsic resistance to HIV, and they're trying to mimic it with COVID. But there are some people who have an intrinsic resistance to COVID. They don't get it as easily as, for instance, Lynn.
No question.
She's vaccinated, but she still got it.
I usually tell my wife, I said, I grew up in an environment where there's infection every day.
Right.
So my immune system is fantastic. And I said,
primed.
But I also don't treat myself. Anytime there's an issue, go to my primary care doctor. I still visit my primary care doctor once a year. Don't tell her what to do. She does her testing. Because of my knee problem, it got really bad about 5-6 years ago, and I was having a lot of pain issues, and I had limited my activity. My weight went up, and my blood pressure went up. And last year, after I came back from Pakistan, my hemoglobin A1C went up. So I got put on metformin, and this year I believe it's going to be normal because my weight is down and my blood pressure is normal. So the point I'm making is doctors shouldn't treat themselves or their relatives.
Absolutely.
Somebody else needs to take care of it. We, as doctors, let me tell you, a lot of my colleagues used to do that. They would take medicine from home to take care of his wife. I said, you're doing wrong. This is wrong. You should not be treating. Let someone else independently, from a different look, make a decision what's wrong.
The problem is doctors are so busy with the sick. It takes a month to get in.
I realize that, but at the same time, if your symptoms are significant enough, the physician assistant should get attention from the doctor, and doctor should contact you and prescribe you if they are not able to see. And once the treatment gets started, they'll get you back in the office in a few days later because it is an urgent situation. Unfortunately, a lot of the time, the staff is busy these days and they have a lot of lined up patients. And this electronic stuff, I could talk about it for days. This has really messed up the medical care.
Oh, absolutely.
I tell everybody, I retired in 2019. If I was still working, I'll hire a physician assistant to put my notes in.
Prescribed.
Because I still want to sit down with my patient and talk to them and answer their question and their family's question.
Nasir, it's not the electronic system that messed us up. We have messed up the electronic system the way we use it.
Well,
It's a tool.
I don't,
You know,
whatever the reason.
Honestly.
I'm basically
I-
saying is, a lot of the people tell me
Yes.
it takes so much time.
Right.
And then it goes off the air, and then you're logging on again, and it messes
The
up.
way it has been implemented, it's not been implemented by physicians who are actually practicing medicine.
Yeah.
It's implemented by insurance companies, by hospitals, so the tool is designed in such a way that it is not doctor friendly. It's not friendly to the people who are actually giving the service.
Well, let me sort of tell you my opinion about it. You know, everybody has a goal of certain amount of money they want to make every year, right? That's the fact. No, that's the fact. I'm not telling you anything wrong. In every business, we have a goal, okay? Now, if I hired somebody at $50,000 a year, and I cut down my income by $50,000 a year, but my patients were happier, and I was happier, and I was healthy, and that 50,000 loss to me is worth every penny, because I want to be a doctor for my patients, not necessarily for the money. If it's a little less, God will give it to you. It happens. I believe in that. The point is that a lot of people have a goal. Oh, I want to. Oh, if somebody else is making $500,000, I got to make 550,000. What is this? We shouldn't be chasing that. We should be taking care of people who have come to us with their concerns. That should be the most prime important. So my personal physician, I have a sleep problem. If I go to see Dr. Ahmed, he's like me, because I told him about that. Somebody else puts in notes. He talks here. He talks to patients. That's the way it ought to be. A little less income doesn't hurt anything.
Dr. Ali, when I was in residency, RSV just infected kids, or at least that's what we heard.
It probably was there, but we didn't talk about it much.
But why is it infecting adults?
I think it probably has maybe also some mutation,
Mutated.
which has affected especially the kids much more so.
Right.
And it can affect the older folks also, equally. So if an elderly person gets a pneumonia, it may be streptococcal you treat, but it could be, if they are not vaccinated for influenza, it could be influenza, it could be COVID, and it could be RSV. And there are sometimes only 40% of the people in this country have been vaccinated properly. So you can imagine 60% are at risk for combined infection.
Nasir, what's your opinion about the skip from animal viruses to humans and mutation because they are prevalent in certain
Well, you remember that was the original concept,
yeah.
that it
You
came
think
from
this
China.
COVID is there's a controversy about that,
Yeah, I know.
and we have known that this can happen,
Absolutely.
but I don't know if in the situation of COVID it actually did happen or not. What is your feeling about this?
Well, I personally believe that there may be some relationship, but I can't really answer it because even World Health Organization couldn't come to any conclusion about it. You know, they gave up on it because China didn't want them to look into their laboratory situation.
So what type of, Dr. Habib was here last week, a couple of weeks ago, and he spoke about homeopathic technique. What's a good, if you don't want to take medication, what's a good natural source to prevent
I really
respiratory?
cannot answer that question, but I can sort of tell you my own take on it. A healthy lifestyle measures go a long way to getting your immune system in the proper situation. What do I mean by that? If you exercise, that improves your immune system. Don't smoke, alcohol, they all suppress your immune system. Okay? And also a dietary situation. People who are overweight are at greater risk for all kinds of infections, especially respiratory infections. Why is that? I cannot tell you. If they are non-smokers, but still is a risk. As you know, in COVID earlier on, you saw a lot of the older, a lot of the heavier people, younger folks, but who were heavy, they were in the intensive care unit. Much more serious problem. We still don't have an answer for that. I don't think we understand anymore. Because some of them were non-smokers, they were teachers, just, happened to be heavy, and women especially. So I don't think I can answer your question. There are people who believe in alternative medicine, and I think there probably certain good things about it. My dad strongly believed in it. He never used to go to an allopathic doctor. He said homeopathy is the best, or a hakim, as they call it, we used to call it back home. They were the best. You got that Joshanda, that non-stinging stuff, which was hard to drink, but it worked everywhere. Because those are self-limiting illnesses. I used to tell my patients earlier on, if they had not serious problems come to me with flu, I said, with treatment it takes 7 days, without treatment it takes a week. That's true, because it's self-limiting. If it hasn't caused you that much problem by that time and no superimposed infection, you're going to be okay.
And with Hakims, they always injected, like in Khamir Marwarid and all of that, it's steroids.
I remember.
And so the person feels great because they have steroids on board.
Yeah. Before partition, I was in New Delhi because my father was stationed there. He was in railway mail service. And anytime we got sick, those are the common things, dalia,
Haldi.
And also
Turmeric.
lentil soup.
Yeah.
Or chicken soup here, whatever you wanted to, they did work. Yeah.
How about as far as cold air? How does cold air, for instance, like we're out
Very
shoveling snow or
interesting
something?
Good question.
The weather change can affect a lot of people, but the cold air specifically makes respiratory symptoms worse in people who have an underlying tendency towards allergies.
Or asthma.
Not necessarily asthma, just allergies in general. Even if you have skin allergies, you are exposed to cold air. My nose runs all the time. I have lots of allergies. As a matter of fact, I'm on 2 medicines to stop my nose from running. I take Zyrtec as well as Sigvair by my doctor. So the point I'm making is it's not an easy situation, but the cold air makes things worse in people who truly underlying have a tendency towards allergic type of problems.
But can cold air cause respiratory problems as opposed to
once you have a cold air, it can affect you, yes, because the bacteria do grow. They don't like hot air.
bacteria don't like hot air?
That's why you have very few respiratory infections in summertime from viruses. You get generally gastroenteritis, or other kind of problems. But in general, cold air attracts these bugs much more so. Viruses first and then bacteria next.
Dr. Ali, I think Ahmed's question is a very good one because we have a concept, I think it's in the Arab world too, in Pakistan, sardi latte. That, and even in the United States, I was out in the cold, there was a change of weather, and that's why I got sick.
Yeah.
So they think that by going out in the cold, the germ is causing the infection. So there is.
Well, I think in general, it is basically if somebody has allergies, it could truly be a true fact. And in back home, who knew about allergies?
Right.
I mean, I only knew about my father and my uncle that they had asthma. But on the other hand, my father smoked like this, So he died once he was 61. I mean, he raised 7 kids, but didn't live long enough.
Huh?
Yeah. Ultimately, the diagnosis by the doctor when he died in 77 was that he had a stroke.
What is the role of vitamin C as preventive?
From my standpoint, it's up here. All vitamins are good as you get older, but if you have a regular balanced diet, you really don't need it. I mean, once you have brittle bones, then you need to take calcium and vitamin D. You know, there are certain situations, if you have visual situations, the vitamin A is good. Vitamin D obviously is very, very important. Vitamin E has certain roles, but I personally believe a balanced diet, healthy lifestyle is the best.
So remember we read the book by Pathology by Boyd,
Yes.
in which he said, get your vitamins from the grocery store rather from the drugstore. He meant by buying the food that has the right ingredients is much better because there are so many other elements that are not
Natural
vitamins, but they are good nutrition for you.
That's why Mediterranean diet is supposed to be the best. They don't take vitamins. They have natural foods, which are rich in.
On a comparative note, which is more healthier, to live in Florida or in Ohio?
Healthier? You want to take my belief? Toledo, Ohio. Toledo, you know why? My prediction is when all those big cities on the coastal area start going down, the cost is going to go up, and they're all going to move back up to northern Ohio. Because the cost of living here is on an average 20 to 25% less than the coastal areas and stuff. You have 25 cents out of every dollar in your pocket. You can decide whom you want to do. You may have the benefit of no income tax in Florida, but they tax you everywhere else.
But from the medical perspective.
They got to get some money in the state somehow.
From the medical perspective, what is better? The warmer climate of
For me,
Florida or?
I came from a warm climate.
Yes.
I love Toledo, Ohio. I can always wear a parka, but I can't take too many clothes off down south. I mean, I actually get sick. I go there maybe once or twice a year for a week or 10 days and come right back because, number one, I have a lot of problems with my air quality, air pollution. My nose runs, my eyes run. I usually end up sitting inside or maybe near a nice pool, a swimming pool or something. But people also don't know how to drive. They're moving from this lane to this and making everybody put horns on and everything else. I hate that. And as a matter of fact, more recent information is that there are some people who go from out of state licensed. They get put on all kinds of bad notes on their cars because people cannot afford housing. Local folks cannot afford housing because all the housing is being bought up by all these rich northerners who go from the north. That's actually true. I read it in the paper. I still subscribe to Slate of Late. I don't want Mr. Block to go broke. He only has 2 issues a week, but I still pay a couple $100 to him every year. Any other questions?
Yeah. Just like, you established the fact that the best thing is to build up your immunity by eating good in terms of sleep well, drink well, exercise, and that's great. But also it looks like even when I was young, and probably most of us heard about it, it's okay to have infection over immunity.
Okay, thank
Yeah. So could you comment on that?
Absolutely.
A mild to moderate infection which does not cause you serious symptoms is actually good for you because this does allow production of the antibodies. And I believe that I might have had asymptomatic COVID earlier on because I used to go to the hospital quite often. And, we used to have a mask on, but who knows? So I believe that allowing yourself to have mild infections is actually good for you. Just like I gave you the indication that when I grew up in Pakistan, everything is unhealthy all around you. I mean, there's feces in the street, all kinds of bad stuff. I'm a survivor of malaria, typhoid, I had jaundice, hemolytic jaundice. My hemoglobin was 3, I never got any transfusion. My spleen was up here, all the way down here, and the liver was down. And I survived that. I survived amoebic dysentery, ancillary dysentery. When I had partition, we moved to Lahore, a place called as uh, Shadrabad. There was a tent for us. I got cholera. I survived that one. So the point I'm making is that growing in unhealthy environments probably gives you some good immune response. But unfortunately, many of those places today are also lacking food, lacking, a lot of poverty around, and there are other issues which can maybe impair your immune system. Malnutrition is one of them.
We have a question online. Are the lungs affected by fibrosis? Can it be reversed?
Ah, interesting. Who asked that question?
Saeed Zafar.
Oh, you did? Okay. Anyway, I did not say much about pulmonary fibrosis, along with the COPD, which is where the airway and lung problem, largely due to smoking, but there are a lot of reasons for the COPD. Pulmonary fibrosis is an evolving condition which was not recognized too well for a long time, even by pulmonologists. We generally tend to sort of think about it as part of a relatively mild problem, but pulmonary fibrosis is basically scar tissue in your lung. In emphysema, you might have heard about the fact that your lungs are large, but you're basically breathing through the top of your lung. In contrast, pulmonary fibrosis is a condition which shrinks your lung. That elastic tissue no longer can expand and relax. So the air does not get in. So you're constantly breathing kind of short. What causes it? The commonest cause is that we don't know. The other commonest cause is the environmental factors, especially occupations. Occupations, especially involving dusty environments. You might have heard about asbestos. You might have heard about silicosis, which is coal miner's lung. The point I'm making is a lot of different things and a lot of autoimmune diseases can produce it. Basically, the diagnosis is now very easy to make once somebody has shortness of breath and cough, and the chest X-ray shows minimal or no scarring, but a CT scan, high-resolution CT scan of the lung is the diagnostic feature. And you actually may not even have to go to any diagnostic biopsy test afterwards if you are able to just diagnose based on that. But most of the time, these new expensive drugs require you to have a proof for it, so you may end up getting a biopsy to confirm the pulmonary fibrosis, that there's no obvious cause. Okay, certain types of pulmonary fibrosis which have an underlying cause are easily reversible. The others in which we do not know the cause are generally rapidly progressive, and especially if a worker continues to work in an environment where there's pulmonary fibrosis, you've got to move. Doctor has to take them out of that environment to make sure that they don't progress.
I'm under instruction that the speaker has to continue till 1:30.
I can go longer if you want to, no problem. Anybody has any other questions? Please feel free to ask.
Adnan, I do have a question on the COVID vaccine.
Sure.
The first one I had a very bad experience with it, which was really weakened my heart. And I had a hard time breathing, lifting things. And fortunately, thank God, I regained all the strength and the breathing and all that. But I began disbelieving in the rest of it.
Well, I just want to tell you, I have a little theory about it. I don't have any proof for it. That if you're carrying a COVID infection, even though it may not cause any severe symptoms, and you happen to have the vaccination done within anywhere from about 2 to 8 weeks, you could develop a severe reaction. I believe There's some reading that I did in New England Journal of Medicine. There were some case reports in which that was confirmed because afterwards they found the antibody response much higher than anticipated from the vaccine itself. That's a hypothesis, but there are no question there are some people who have had a reaction to the vaccination. As you know, there was a lot of push earlier on, no vaccine, allow the people to build up their own immunity, but while the patients were dying.
Yes.
That was wrong. When you have an active pandemic going on, you got to be vaccinating as soon as it became available. And remember, it became available in December, but really acceptance was not there till almost in that spring.
And
To a
supply,
large extent.
supply also.
We just delayed it because we still had some questions about it.
Join me in thanking Dr.
Excellent.
Anytime.